TEAM CBT is a framework for what makes psychotherapy effective. So it's not so much a school of therapy as it is tools that we're using for making any school of therapy really effective. So the TEAM is an acronym, and it also stands for just our philosophy of how we work with patients. I'll start with that. So as far as TEAM is concerned, like let's say you were a patient in therapy with me, the idea is that we're collaborating together as a team. We're equals. It's not like doctor-patient, right? And in fact, it's very client-centered. So the agenda that we work on in therapy is based on what it is that you want to get out of the therapy rather than what it is that I'm prescribing for you. I'll also say that, it's an acronym. So the T in TEAM stands for testing. This is one of the most exciting things about the therapy, if you can get excited about data and math, but we're using a brief mood survey before and after every session. That's testing for things like what is your level of depression and anxiety and suicidal thoughts, and also your positive feelings and relationship satisfaction. And we want to see those levels right before the session and then right after, so that we can notice after the session, how did we do just even in that 150 or 110-minute session? Did we see negative feelings going down and positive feelings going up? And over the course of several sessions, we can also see how are we doing. Are we seeing things trending the way that we want to? So that if we're not, we can adjust the treatment plan right away so that we are getting the effect that we want. We also use an evaluation of every therapy session. So after each session, the patient is asked questions like, did my therapist do a really good job of listening to me? Were they warm, supportive, and concerned? Were they trustworthy? Did I get a chance to talk about the things that are important to me? Did I learn something that was helpful to me that I'm going to use in my life after this session? And then some open-ended questions like, what did you like least about the session? What did you like most about it? And it's all going towards this goal of just making this therapy custom-made for that person and as effective as possible. And of course, we have a big emphasis on the treatment being brief. We don't think that therapy needs to go on and on for months or years. So we want to get kind of our biggest bang for the buck out of a short amount of time. And so the testing really helps us with doing that. And then the E in TEAM stands for empathy. And that's similar to anybody who's ever been in any kind of therapy would probably say that one of the most important things was the relationship that they had with their therapist. So we put a big emphasis on, listening well, understanding the person, really seeing things through that person's eyes as much as another person can. And what I really like about TEAM CBT is that we have really specific tools that we use called the 5 Secrets of Effective Communication, where we learn how to use empathy, assertiveness, and respect in order to really skillfully use empathy. So I can usually count on, like, within the first hour that I'm talking with somebody, that they're going to feel like they were really listened to, heard, understood. There's some trust built, some rapport built. All those things are super important in therapy. I would say that they're necessary for the therapy to be effective, but not sufficient. So that's why we have the other elements of TEAM. The A in TEAM stands for assessment of resistance. And this is where I think we really stand apart most from other kinds of therapy. We have methods that we use that are really powerful for helping a person lower any kind of resistance that they would have to change. So that when we come in and we use the M of TEAM, which is methods, then the methods that we use have a much higher chance of being effective and in a short amount of time. The methods that we use are drawn from really any school of therapy that's just been shown to be effective. So I tend to draw from the methods that are specific to TEAM CBT because that's what I have the most experience and training with. But somebody could be using TEAM and psychodynamic therapy or EMDR or DBT, whatever. There's like 100 different, initials out there for different types of therapy. But we're going to be leaning on cognitive therapy, and I can talk a little bit about that if that's interesting, but which is basically changing the way that we feel by changing the way that we think. So I'll talk a little bit about just cognitive behavioral therapy if that's helpful and gives you some good info. So the idea of cognitive therapy is, the whole theory behind it is events that happen to us in our lives don't make us feel things, right? Like nothing that's happened to either you or me has made us feel something. It's always our thoughts about that thing that happened and the way that we're interpreting it and what we're telling ourselves about what it means. And we can see that that's true when you consider that the same thing could happen to two different people, but they may have a totally different response to it. And that's because of how they're interpreting it and the meaning that they're giving it. So with cognitive therapy, we simply take a look at one moment in time when, let's say, somebody was feeling really depressed. And what were the thoughts that they were telling themselves that were leading to depression? And usually the thoughts that lead to things like depression or anxiety or some kind of mental health problem are going to have all kinds of things in them that aren't true. And when we can discover what's not true in our upsetting thoughts and replace those thoughts with more balanced thinking that proves that those negative thoughts aren't true, it'll have a huge impact on the way that we feel. And it sounds a little bit goofy when you try to describe it. It seems like that, how could the way that I think actually affect my feelings that much? But it actually is really profound. Like when somebody can take a thought, like let's say somebody is telling themselves over and over again, I'm a loser, because of X, Y, Z that happened in their life. And when they can look at that thought and realize, well, that thought has a lot of all or nothing thinking in it, right? I'm a loser. Where am I getting that information from? What do I mean when I tell myself that? Does that mean that I lose 100% of the time at everything? Or if I ever won at anything? And well, actually, if I look at my life honestly, I've won some and I've lost some, right? Just like most people. And to tell myself that I'm a loser is probably harming myself in a way that's not necessary. And there's lots of other, distortions that I could look at in a thought like I'm a loser to kind of poke holes in it and prove that it's not true. And then when I come up with more balanced thinking, it would be something along the lines of, well, actually, there's no such thing as a loser. There's nobody who loses at everything, right? That doesn't exist on the planet. What exists are human beings with strengths and weaknesses. And I'm no different than other people who have struggled. And when I tell myself that I'm a loser because sometimes I don't always win at everything, I'm just holding myself back and making myself feel really terrible about myself, kind of based on things that aren't true. So instead, I'm going to focus on, are there specific things that I could be doing better? Are there things that I can improve at? And can I accept myself as just a person who's got some flaws? And then what that does is it causes an immediate shift in the way that I think. And then what I've done is I've set up new pathways in my brain that are now going to be, if I exercise those pathways, then my automatic thoughts, when I get some kind of thing that happens in my life that would normally trigger really negative thoughts, my automatic thoughts will now be more positive because I've practiced and I've addressed those things ahead of time. So that's kind of a long-winded answer for just like what is CBT. That's the cognitive side of it. The behavioral side of it, I would say we could think of that in the context of anxiety pretty well. So a lot of people will come into therapy for anxiety, and a lot of the time they're doing a lot of avoiding of the things that they're afraid of, and which makes sense, right? If there's a thing that I'm afraid of and I don't want to be around it. I want to avoid that object or that animal or that place or that experience or that thought. I don't want to picture the things that I'm afraid of. But the problem is the more that I avoid things, the bigger they become. And it's the things that we resist that persist. And so in therapy, with cognitive behavioral therapy, we're going to want to expose ourselves to the things that we've been avoiding for a couple of reasons. One reason is the more I'm around something that causes me fear, the less afraid of it I'll become, right? It's kind of like people who get really into scary movies, right? Like if you've ever, let's say somebody becomes a big fan of Hitchcock films and they really like the movie Psycho. The first time that they see this shower curtain get pulled back and a giant knife come up in the screen, like it's terrifying, right? But if they watch that over and over again because they're interested in how was this made, how did that, I didn't see any blood, but it was terrifying, then the more they watch it, the less scary it becomes and the more interesting it becomes. And that's kind of what we're doing when we use exposure therapy. We expose ourselves over and over again to either frightening images that we've been avoiding, or a place that we associate with something bad that happened, or if somebody wants to get over a fear of dogs, they have to be around dogs a lot, to where it just doesn't seem scary anymore. The other thing that happens is called inhibitory learning, and that's where we're reteaching that part of the brain that's responsible basically for human survival, right? It's like why you and I are here talking right now is because we do have a stress response built into our system that causes us to fight, flee, or freeze, right? The problem is that that system is getting overactivated by things that are actually not dangerous to us. And so we want to expose ourselves to the thing that we're afraid of over and over again, and actually try to make ourselves anxious. I'm going to try to get my anxiety at like a level 100 out of 100 and keep it there for as long as I can so that my brain can be retrained to understand, oh, wait a minute. Just because I feel afraid doesn't mean I'm actually in danger. And so that's a big part of behavioral therapy when we talk about cognitive behavioral therapy.